I'm Tara Glenn. I'm a neonatologist. And so, what that means is I'm a doctor, and I've gone through extra training first in pediatrics and then in neonatology. And neonatology is a field devoted to taking care of newborn babies who are sick. So, the vast majority of what we see is prematurity. So, babies can be born very early. The earliest a baby can be born is at about 22 weeks, which is 18 weeks early, and still survive outside the womb. And those babies need very specialized care for many months, up to more than a year, in order to survive and be able to go home from the hospital. Some of the other types of babies that we take care of are babies who are born with birth defects, with genetic syndromes, babies who have infections after birth, or problems during delivery. If they have difficulty sort of during labor and delivery being able to get the baby out, oftentimes the baby will be sick after something like that. One of the things that I love most about my job is the delivery room resuscitation. So kind of being in the delivery room and knowing that a baby isn't doing well, whether it's a premature baby or a baby that hasn't had a normal heart rate tracing or a complicated pregnancy, and knowing that after that baby's born, we're going to have to do a lot of interventions in order to help that baby and get them breathing and get their heart rate going on their own. So that's one of the things I think that is really exciting about my job, and something that is specifically what draws me to neonatology. On the other side of things, it can also have a very long-term piece of things, because as I said, many premature babies will be in the hospital for a very long time. So I like getting to know families, seeing them every day for weeks to months, watching the babies grow and watching them get past a lot of the challenges that they have at the beginning, and seeing them get to the point where they're ready to go home. I think one of the things that's really nice as well in all types of medicine, but that we do see in neonatology, is that we're able to interact with all different kinds of people. So if you go into some fields, you might only interact with other people in that field with you. But when you go into medicine, you're going to interact with all sorts of different people. On the staff side, you interact with nurses, respiratory therapists, occupational therapists, physical therapists, pharmacists, all sorts of different people who help us do our job well and run the hospital. And then you also are able to interact with all different kinds of people in the form of your patients and their families. So that's something that's been really valuable and really helps to keep perspective every day. So that's kind of a quick summary of what I do. And then I'll talk a little bit about the education required for becoming I'll talk about neonatologist, but also touch a little bit on other types of medicine. So the first step when you decide that you want to go into medicine, first of all, there's a step that's just deciding, do I want to go to medical school and be a doctor, or are there other fields kind of within medicine, kind of some of those ancillary professionals that I talked about that might be a better fit? So I think that's kind of an earlier question that's helpful to answer. I think if you're more of an academic-minded person, if you think you might want a role in doing clinical research as you progress, if you really like the idea of sort of being in charge and having your own responsibility for your patients and being kind of the final person in that hierarchy, then probably going into medicine to become a physician is the best thing for you. But if you're really only interested in one niche of patient care or taking care of patients, then sometimes some of those other fields might be something that you're drawn to. So the first step, sort of starting in high school, I think the main thing that when I think back to when I was in high school, and the main thing that's going to be a theme throughout your life if you decide to go into medicine is going to be working hard in school and getting good grades and being able to study for and take tests. Because that's kind of going to be a consistent part of moving along in the steps needed in order to become a doctor. So back in high school, the main thing, as I said, is to be getting good grades, taking advanced classes when you can, excelling in those classes and doing well. Extracurricular activities are important, and you guys know more about this than I do. I think specifically for medicine, some activities you might want to consider would be volunteering in a hospital, and then maybe getting your feet wet with some kind of research if possible. But a lot of what you're doing at this phase isn't necessarily to get to the next step, but more to be able to discern if this is really what you want to do and what you want to spend your time doing. And there's plenty of time to decide that as you progress further on. When you get to college, I think, again, it's important to kind of maintain good grades, maintain that basic knowledge that you're getting in the health sciences and life sciences, as well as sort of getting a well-rounded education in other areas. And then during college is when you really want to try to get yourself in some research experience. So there's different ways to do that, but oftentimes having a personal connection is what makes the difference in getting an opportunity. So something like having a friend who is a physician or in a health system getting you a job in the summertime as a research assistant can get you that experience, which can really help you in your applications for medical school. And then during college is when you take one of the first big standardized tests that's really focused in medicine, which is the MCAT. And that's changed a little bit since I took it. But ultimately, this, just like many other tests that you take in life, but especially in medicine, just involves doing a lot of hard work to prepare, doing practice questions and making sure that you are the most prepared that you can be on the day that you take that test. So having solid good grades, some research experience, and good test scores are going to help you get into medical school. So medical school is 4 years. There are some options that combine medical school and undergrad if this is something you're really sure of, sort of when you're leaving high school. That can be 6 or 7 years, but for the most part, most people will do a 4-year college and then 4-year medical school. And the first 2 years of medical school are focused in the classroom. So that's when you're still learning, just in that phase of just getting your knowledge base up in all the things that you're going to need to know in order to take care of and diagnose and treat patients. At the end of those first 2 years of medical school, you do take a big test, which is the United States Medical Licensing Examination, Step 1. And then after that, in your 3rd and 4th year of medical school is when you start doing rotations. And it can feel sort of very rewarding to get to that phase because you've spent all these years thinking that you want to be a doctor, spending time maybe shadowing, maybe volunteering in a hospital, but never really getting to take a big part in taking care of patients until you get to that point. So even though it can mean longer hours and less predictable hours, working nights, working weekends, it also is a really rewarding time because it's the first time you're really a part of the patient's medical team and you're learning how to take care of real people. And you see these diseases that you learned about in your textbook, but you see them in a person. And once that happens, then you really remember it and know it much better than you ever did learning it from a textbook. So 3rd and 4th year of medical school, I think, are very formative years. That's when you want to choose your specialty and apply for what specialty you're going to go into. Most of the specialties are divided into kind of 2 big fields, and that would be medical specialties and surgical specialties. So more medical type specialties would be things like pediatrics, internal medicine, family medicine, and then more surgical subspecialties would be like general surgery, and then things like ear, nose, and throat surgery, other types of surgeries that you might also go into. So for me, the decision to go into pediatrics was a pretty easy decision, and I tend to be someone who makes decisions fairly easily. And I did a rotation. I was sort of thinking towards pediatrics in my 3rd year of medical school, but I also liked internal medicine. I knew I didn't want to go into the surgical subspecialties. I didn't like being in the OR. I liked talking to patients. I didn't like any part of that. So it was sort of looking at medicine and pediatrics and a little bit of OBGYN, but that was sort of short-lived. And then I did a rotation in the NICU in my 4th year that I just really loved. I knew that it was the right thing for me because I really wanted to go to work every day. I was curious about what was happening with my patients when I wasn't at work. When it was my day off, I was looking to see what had happened on that day. And it was something that I just really felt drawn to all the time. And I think that that was the point when I knew I probably wanted to go into neonatology, but the first step for that is going into pediatrics. So that there's this level of specialty and then subspecialty. And specialty is what you do during residency, and then subspecialty is sort of further training in a specific area that you do during fellowship. So these are different training programs that you do after you finish residency, after you finish medical school, sorry. So everybody has to do a residency in order to practice medicine, but not everybody has to do a fellowship. So I picked the residency of pediatrics with the goal of doing neonatology, but I was sort of open to other fields within pediatrics as well. Pediatrics is a 3-year training program, as are most of the medical subspecialties. The surgical specialties are going to have longer residencies and tend to have a little bit shorter fellowships. So you end up doing a little bit more training for a lot of the surgical subspecialties, but sometimes it ends up being about the same. So the pathway that I took was pediatrics to neonatology. Other sorts of fields within pediatrics, a lot of people will go on and do what we call general pediatrics. So that's a pediatrician like you might see, in the office, someone who takes care of patients, sees babies through young adults for their well child checks, for sick visits, and sort of coordinates care among other subspecialists when needed, when things are more complex. And those types of doctors are really the frontline physicians for taking care of most people in this country, whether you're relatively well or whether you have a lot of medical problems. That's always going to be the first line kind of group of people that's taking care of most of our population. And then moving on to subspecialists, those are sort of people who want to get out of that general sort of field and focus in on something really specific that that they want to be experts in. So for me, that was neonatology. So I still am a board certified pediatrician, but I don't see anybody outside of the hospital. I only take care of babies who are in the NICU in the hospital. I don't kind of have an office or take care of patients on an outpatient basis. Just other paths that would be possible would be like maybe if you liked surgery, you could go into orthopedic surgery, which is surgery taking care of bones, and then you might do a subspecialty in hand surgery. So that might be how someone would become a hand surgeon. Another example would be if someone wanted to go into internal medicine and then they wanted to become a cardiologist. So internal medicine and then cardiology fellowship in order to take care of heart problems. So that's kind of a little bit of what that medical training looks like.